Oh, hi. Welcome back to Simply Anju. I hope you're all enjoying your Eid holidays. Happy Eid to each one of you. And I hope you're all following the rules and regulations that has been put forward by the respective governments. In continuation to the COVID-19 precautionary measures that we are taking in terms of washing our hands using a soap and sanitizer, I would like to throw some light on the skin care that you should be aware of, because we know the frequency of our usage of the sanitizers and the soaps have increased to a multitude level. The frequency is means I'm sure we have this as an OCD now, like we need to use a soap or a sanitizer each time after maybe even after touching a plastic cover. This is what we would feel like doing. That has become an OCD now. So, excessive usage of soaps and sanitizers, is it doing any harm to our skin? This is what we would like to speak about today. For this, I would like to introduce my dermatologist friend, Ms. Shameena Syed. Dr. Shameena Syed is a graduate of Tribhuvan University. She has completed DCD and MSc in clinical dermatology at the Welsh Institute in Cardiff, UK. She has trained in general outpatient dermatology clinics in Cardiff and the surrounding hospitals like Princess of Wales Hospital, Prince Charles Hospital, and the University of Wales Hospital. The training enabled her to observe and work with a variety of skin conditions prevalent in the European population. Her area of interests lies within the scope of cosmetic dermatology, hair disorders, and aesthetic indications, along with a keen, passionate interest in general dermatology.
Thank you, Anju, for the lovely introduction and for calling me on to your channel. It's a pleasure and a privilege. Without wasting much time, let's get to the crux of the video. And coming to your first question, which is more effective in washing your hands and getting rid of germs and viruses in this era? Is it a soap or is it a sanitizer? So, technically, um, they both would do the trick. But when you're using a soap, it's important that you wash your hands under running water for a good 20 to 30 seconds, and you include areas like the back of your hands as well as the nails, because these are the parts which we usually skip. So it doesn't matter what grade soap you're using, as long as it lathers and you show your hands under a running water for, as I said, a good 20 to 30 seconds. And if you do not have access to water nearby or repeated washing with soap, then any sanitizer with 60% of alcohol will do the trick. Between the two, there's really no scientific data which says one is more efficient than the other. Both are equally good if used properly. A very good question, the next one, whether prolonged use of hand washing or sanitizing is going to be harmful in the long run. Well, it is a tricky question, but I would like to give the truth here that yes, we are playing with the pH of our hand with such excessive washing and sanitizing. The need of the hour requires us to do so, but if we do not take enough care of that particular situation, we can end up with dermatitis as well as further contact related allergies later on. So, washing is the need of the hour, sanitizing is the need of the hour, but if the question is does it cause any damage later on? Yes, it can, if not, if the proper care is not taken care aftercare. So throughout the day, if we are working outside or we are in a position where we need to travel outside, we would be wearing the gloves, excuse me, or washing your hands frequently or sanitizing. What we could do to try to protect the pH of our hands as well as the skin is apply a very thick emollient mixed with solid or liquid glycerine. At night, wrap it around your hands well, and if possible, let it air dry. So this will try to correct the water loss, the moisture loss that would have happened through the day with recurrent washing and sanitizing. So that's any good thick emollient cream. If you can contain urea 5 to 10%, very good. And if you can add a liquid or a solid glycerine to it and make your own DIY cream, nothing like it. Coming to the required content in a soap or a sanitizer that will do the trick, we really don't need to get into the nitty-gritty details, to be very honest. We are not focusing on lightening or whitening or brightening or moisturizing or anti-acne or whatever when you're looking at a particular soap. Any normal soap requires a basic amount of a fat content to emulsify it as a soap, and as long as it's in a bar form, it's in a soap form, it will do its trick. And again, as I reiterated, it is not the content of the soap that's important, but the way and the method that you wash your hand, that's more important. You could be using the best, most expensive soap and still not washing your hand properly, or you could be using the most off the mill soap and still be getting your job done. So it doesn't matter what the content of the soap is, it can just be anything that lathers well and you wash in the prescribed WHO guidelines and under a good running water for around 20 to 30 seconds. Sanitizer, usually 60% and above alcohol is what is available, and that's good enough. Again, the movements is very important. Your thumb, your hands between, and your nails. These parts are very important.
Thank you so much, Shameena, for that informative session. I'm sure everybody who would have seen this is going back with a set of very informative tips. Thank you all for watching, and anybody left to subscribe to my channel, please don't forget to hit that red button. Subscribe. Thank you.